Now starting. All attendees are in listen-only mode.
Welcome to today's webinar, Optimizing Patient Care and Experience Through Customized Assessments. My name is Danny Smith, and I'm the Manager of Events and Marketing at Microexcel, and I'll be moderating today's webinar. During today's presentation, the first in our Assessant webinar series, we will introduce you to Assessant, Microexcel's proprietary, powerful, customizable, cloud-based assessment and diagnosis software application. This overview of Assessant will cover what Assessant is and why your healthcare organization needs it. A live demo will also be included, which will profile the benefits and problems the tool solves. Our presenter for today is Mr. Chris Worsley, Global Practice Director for Microexcel Custom Software Solutions. Chris has over 20 years of experience helping companies design, develop, and deploy mission-critical software applications and solutions. Providing our live demo today will be Mr. Travis Healy, Enterprise Business Development Manager for Microexcel CSD. Travis has over 15 years of experience in helping companies strategically design, develop, and deploy global software applications. So just a few laundry items before we get started. This webinar is being recorded, and a link to the recording will be sent out in a few days. Also, we will have a Q&A portion at the end, so please type any questions you may have in the questions box, and we will get to those in the order they are received. If you have questions after the webinar, please feel free to contact us at info@microexcel.com. At the conclusion of today's webinar, there will be a brief survey. Please take a few moments and share your thoughts with us. So without further ado, I'd like to present our first speaker for today's event, Mr. Chris Worsley.
Thank you, Danny. We appreciate all of you joining. It's nice to see so many people have joined us today for this session. It's always great to be able to get together and talk a little bit about some of the things we're doing. First of all, I want to just briefly introduce Microexcel for anyone that may be unfamiliar with our organization that is sponsoring this webinar. We are a global IT software and services provider with locations across the U.S., India, and the Middle East. Our global focus is to provide inventive solutions from out-of-the-box products from companies like Microsoft and SAP to our specific practice here at Microexcel's Custom Software Development Group, which is to create practical and innovative custom software for a variety of industries. We've worked with industries like nonprofit associations, membership organizations, healthcare and medical providers, hospitals, manufacturing, pharmaceutical, insurance, education, and more to design, test, and deploy custom software applications. And our software specialties range from web-based applications to native mobile applications as well, and everything in between. So as we get started, I'd like to introduce our our plan for today, our agenda. First of all, we'd like to talk about the dual benefits of using assessments for your organization. We will introduce a solution that we've created called Assessant. We'll talk a little bit about Assessant works and how it addresses some of those benefits that assessments can provide. And then we'll talk about why you might want to choose or use Assessant as a tool within your organization. And finally, we'll end with a brief demonstration of the product, giving you a high-level view of what Assessant is all about. So I will like to jump in and talk a little bit about the dual benefits of assessments for an organization. We want to thank you for taking the time to join, and we think this will be an opportunity to talk about an application that could change the way you engage with your patients across a healthcare organization. It's not only helpful for you today to gather feedback from your patients, but it is critical in order to generate the best care and experience you can offer. Understanding how your patients engage with your services, as well as knowing what might be holding them back, will give you the information you need to empathize with their expectations and help them understand yours. The most common way that people gather this kind of information is through a simple survey taken online. For example, you might ask your client or your patient how satisfied they were with your service. There's no better feeling than getting data back that says people like what you do, or even provide recommendations for things that you could do better. Although this might be a good validation for your success, it does not actually help you know all that you can do better. In fact, even if the survey has space for patients to give additional feedback, that information is always difficult to parse through and is usually subjective. In the end, surveys only offer basic feedback, simple use case information, and customer satisfaction data. Although those are helpful, there could be more, and this is where an assessment comes in. Assessments, on the other hand, can do all of that, as well as gather detailed and quantitative data that is specific to your needs and what you're looking to gather. In fact, a well-crafted assessment charted over a number of patients or time has the ability to reveal specific successes and pain points of your services, information that could be critical in making your organization better. So the biggest difference between surveys and assessments is the latter really gives you the right and necessary information for the things that you're working on and how you want to be working on them. Assessments are also an invaluable resource for tracking patient progress, something we like to call today in the industry outcomes. Today, diagnosing assessments are already used everywhere in healthcare to gather detailed information about a patient's status. These come in all kinds of forms, from real-time medical evaluations to paper questionnaires. Imagine capturing similar data and then being able to track it over a period of time to understand a patient's health progress. Much like understanding how patients feel about your services, assessments might offer insights into how they feel physically and maybe how they will feel. Either way, good assessments can give additional insight into different patients' unique care challenges. Having an assessment allows you to correctively make suggestions depending upon immediate feedback. That means the assessment can react to how the patient is doing on that particular day. Surveys may help you deliver basic feedback, simple use case information, and customer satisfaction data, while assessments can often offer detailed and quantitative data, critical information catered to your workflow, and the right and necessary information. Although we have praised assessments for their capability to capture great insight, they're not always without their drawbacks. So let's look at some of the reasons you might not want to use an assessment. Oftentimes, there are too many questions and they're too long. You may come in and find that an assessment may require a patient to fill out 3 or 4 pages of questions, many of them not relevant to that particular patient. And so when questions come along that are not relevant, you tend to find that patients will disengage from the process. They just want to complete the process rather than actually interacting in a meaningful way. Often they're never finished and they're difficult to parse through for all that information. Usually it requires a human to go through and read the answers. Oftentimes there are too many questions, in which makes an assessment too long for a person to get through, and can often make the patient feel like you're asking them the same questions, or questions that you ought to know are irrelevant for their case. In this case, it's inevitable that your assessments will be filled with questions and that the patient is not wanting to take. And everyone you see is in a different situation. Thus, if there are questions that don't apply to their situation, then there is no real need for them to see it and answer that question. There are 2 major problems with assessments in this scenario. 1, there are too many questions, and 2, not all of the questions apply to each client. Because of the excess of general and maybe irrelevant information, it becomes a customer experience nightmare and a chore to parse through on the administrative side. The assessment would never get finished, and consequently, you would never get the information you really need. With that being said, data gathered using assessments is still extremely valuable and necessary to move forward with your service. So each of you are put into a tough spot. This is why we often resort to using surveys to gather helpful but usually inefficient data on our services. So let's talk a little bit more about what Assessant is. Inspired by our experience working with healthcare professionals on custom software applications, Assessant was developed as a solution to those assessment problems that I've mentioned that are fairly common and universally common. This application not only allows you to create, manage, and analyze diagnoses and assessment data in a better way, but it dynamically adapts to user input to make sure that they get the right questions asked and have the opportunity to answer those in a complete and full way. Assessant has become a highly customizable cloud-based assessment and diagnostic tool. It can also be downloaded on-premise at your office or organization and integrated seamlessly with existing applications to make moving forward that much easier. For example, onboarding. New patients may come in and you want them to take an onboarding survey. This assessment tool is an effective way of doing that. Once again, it allows you to create and capture user assessments, any kind of question-based workflow, and analyze critical data to evaluate patient progress, diagnose optimal solutions, engage with users, optimize patient experiences, and help manage critical care, chronic and critical care. In other words, and to put the technicalities aside, Assessant is a platform that gives you the resources to engage with and receive feedback from your patients productively and efficiently. It takes the good parts of the assessment, detailed information and quantifiable data, and makes it better while diminishing the drawbacks of lengthy surveys and irrelevant questions. So again, highly customizable. It's made to be integrated as a software platform with APIs and services. It can be downloaded on premise, has a mobile application that can be used natively on Android or iOS. The application gives organizations the ability to create, capture, and analyze user-patient assessments. It also allows you to engage with clients that might normally require an inflexible workflow format, and you receive helpful insights and feedback efficiently. You can also track and measure how many assessments have been started, how many have been taken and completed, how many have been abandoned. You can even remind someone to complete an assessment. So now let's talk a little bit about what Assessant can do. Assessant has an intuitive API that makes it easy to create powerful client-specific assessments. This means that someone that is a non-techie can go in that understands the kinds of questions and the workflow they want to ask and use a simple interface to create those assessments and then go in and test them. Adaptive and unique pathways guarantee questions will really apply, which means more assessments will get done. Absolute customization ensures that catered assessments will fit your existing needs. Powerful tools that allow an assessor to zero in on correct assessment flow for each individual. That means you can identify the exact question and the order in which those questions are asked, and then track how those questions are answered. Detailed diagnostic information and analytics makes it painless to look through and understand the findings from each assessment. The ability to send and receive assessments securely gives you and your clients ease of mind. You don't have to worry about privacy and HIPAA compliance issues. And it makes patients a partner in their own care, that magical patient engagement that we're all looking to achieve. So let's talk about why you may want to use Assessant. We've talked about the typical problems with assessments, too many questions, they're confusing and often never finished. Because Assessant is dynamic and takes a nonlinear path, not only do you get to the right information for each patient, but you actually get the information that you're looking to gather. People are more likely to finish an assessment if it adapts to their particular needs, their diagnoses, and the outcomes that they're hoping to achieve. Scale. Assessant is simple enough to use for a local contained organization like a hospital, but is robust enough to handle a large scale like hundreds of offices and thousands of patients across multiple states and geographies. It also allows you to save time and money through optimized client assessment communications. So now you know the various diagnoses of your patients. You can send out specific communications that may include 1 or 2 question assessments, asking what their general well-being is and how they felt like they were cared for in their most recent visit. It can also provide them tracking for how their outcomes are progressing. in a way that it can be handled on a much larger scale than a one-to-one visit. So this really covers the main points that we wanted to focus introducing Assessant, and I thought now I'd turn some time over to Travis to give us a brief demonstration of the product.
Hey, thanks, Chris. As Chris mentioned, my name is Travis, and for the next few minutes, I will give you a profile view of some Assessant's capabilities and talk through some of the different benefits that the application provides. When you first log into your Assessant portal, a simple and brandable dashboard is presented, giving you the ability to create, track, and manage dynamic assessments and workflows, as Chris has mentioned. As an individual organization, you can have this, as I mentioned, branded to your look and feel, so it's very dynamic and customizable and scalable. What I want you to notice up here is just a very simple workflow, and we kept this simple on purpose to make it very user-friendly for the experience itself. So up here on the top, when you log singular practices, okay, individual doctors' offices, or if you have multiple divisions that need to be managed within or under, rather, a healthcare organization can be accessed through a simple drop-down and setup. In the interest of our time that we do have today, we're going to walk you through an existing assessment workflow environment for this company right here, MedUSA. Now down below, once you have the organization selected, you're able to drop into the end user client patient detail. Each selected organization practice has associated users. So those are patients, customers, etc. It's really self-definable that you can select to assign new assessments to, or to review the status of pre-assigned assessments that you've sent to these patients. We'll go ahead and, out of personal interest here, I'll select my most interesting patient, if you will, Bruce Wayne, and walk through this workflow. Once we select the appropriate end user that or patient that we want to review and send assessments to and track workflows, a targeted workflow populates for Mr. Wayne, specific to Mr. Wayne. Now, based on the assessments that you've created for Mr. Wayne, you're going to have a number of different things that you can do. Now, the importance here, keep in mind, is workflow optimization. So as our practice has predefined through the assessment setup, we're going to assign a diabetes pre-screen assessment workflow to Mr. Wayne. Once we have that ready, and we can check and verify that, yes, indeed, this is the correct assessment, the diabetes pre-screen. There are a lot of safety checks up front for you to ensure that you're going to be sending out the right information. We're ready to send this on out. Now, once the desired assessment is selected, we can generate a link directly for that assessment associated to, in this case, Bruce Wayne. Now, the link can be sent via email, it can be auto-sent based on API and programming, or you can also send it directly to the patient, as you can see here, with a notification to Mr. Wayne, who has downloaded the Assessant mobile app. So you're not limited to being stuck at a desktop and checking out assessments. You can actually make these mobile and get results very quickly and through the convenience of mobile applications and phones. So a couple of neat things about this product is that through the setup, you can set Assessant to notify you when assessments are completed. You'll get a ping, right? Bruce Wayne's completed his assessment for diabetes. You get the results and you're good to go, and there's a complete trail behind that. You can also set it to time triggers. If Mr. Wayne has not completed this assessment within the next 2 weeks, please let us know. So there are full triggering and events management within Assessant as well. And all done from the standpoint of optimizing workflows, seeing more patients, and really creating an environment for diagnoses, treatment, and recommendations that optimize the experience for the patient, and everybody wins all the way around. So once Mr. Wayne has completed an assessment, in this case, we're going to review the results for the diabetes pre-screen. We can open the review module, and you get to see some interesting information. So in this particular case, Mr. Wayne did complete the assessment that we pre-generated, answered some key questions that we defined would indicate that there's a significant change in Mr. Wayne's profile for diabetes here, and notification triggers that are coming out to us as the end user on a priority basis. This is a pretty serious issue, so we're going to go ahead and get that notification, and it looks like Batman needs to go in and see his doctor. All right, a couple of things of note, and Chris brought this up briefly. Security is of paramount importance for us when we're dealing with patient information. We associate assessments through unique identifiers, okay? So this information can be used via an API to associate to your own personal patient management system without having to require Assessant as a tool to store critical and sensitive patient information, which is good for HIPAA considerations. So the next thing that I'd like to talk about, and since this is a brief overview and we're covering just the core workflows and walkthroughs, Mr. Wayne's assessments, dropping in, checking out the assessment status for each assessment that we've sent out, whether they're diabetes pre-screens or any other type of assessment for medical issues. Unique association IDs, data was assigned. In this case, since we're talking about a demo model, we don't have statuses populated here, but you'll be notified complete, incomplete, when it was started, when it was finished, and a complete data trail for your own records. All right, so the last thing that I would like to just profile and show you, and of course there's a lot more to this, but nobody wants to bore anybody with a deep down in the weeds demonstration of how to set up the logic behind that, which is easy to do, but there's a process. When we're talking about creating assessments here, it's very easy to do. Now the assessments can either be generated from templates that you've already created, and it's very important to use your own logic, right, for your own practice. Each practice is going to have different logic to drive the questions, to lead to diagnoses or recommended treatment plans. The system architecture is very open, very flexible, and very dynamic for you to be able to do that. Right here, once we drop into the Create Assessment link, we can see the existing assessments that we have for the practice or for the organization. When they were created, edit the actual assessments. You want to change a question here and there or adjust the wording in a question. You don't have to go back and recreate everything, right? It's very, very easy and very simple to do. Outcomes, as Chris mentioned, we can change the outcomes, we can adjust them based upon the information that we're getting in, and test the assessments before we actually send them out. As I mentioned previously, and let me just go ahead and minimize a little window here, we're going to talk a little bit about creating assessments. Now, again, it's a very simple walkthrough process. Fill out the basic information, the title that you want to give it, the instructions, go ahead and create. It's a very user-friendly walkthrough module that helps you set up an ad hoc assessment, if you will, or we can go ahead and just upload logic from existing assessments that you want to put into place for your assessment mission. Now again, this was a baseline overview, very simple, very easy to use. It took quite a while to build the logic behind the tool to get it to do what our medical and healthcare clients required it to do. It's very powerful. It's deceptive on the front end, very simple, easy to use, but there's a lot behind it. So keeping in mind that it's a very powerful and customizable cloud-based or on-premise system, it's going to help you, bottom line, optimize patient workflows, create some great assessments that can be correlated to either existing reporting tools or a reporting tool that you want to put into place for a very dynamic enterprise application to give your clients or your practice a great way to optimize workflows for maximum impact. So that being said, we are sensitive of the time that everybody came on board for, and I'm grateful for the chance that I got to talk to you a little bit today. But for a more personalized and in-depth demonstration of Assessant, we can actually walk you through some of your own logic, set up some questions for you, set up a test environment where you can actually use it and give it a roll. To do that, just feel free to reach out to Chris or myself after the webinar. So thank you very much. Danielle, I'll go ahead and turn the time back over to you for the Q&A.
Okay, thank you, Travis. So as Travis mentioned, we are going to open the floor for questions. As I mentioned before, if you have any, please do type those in the questions box. It does look like we have had a question come through, and that first question is, does Assessant integrate with existing healthcare tools?
So Assessant is written primarily to be integrated with other health tools such as hospital systems, practice management systems, EHRs. In fact, we have a number of EHRs that have integrated their product with Assessant. It is a series of web services, meaning that all the functionality that you see on the screen can be implemented natively in the application, the healthcare application. That means it's easy to make it look and feel exactly like the experience that they're used to having within your own application. So it really is designed to be highly integrated into third-party applications.
Thank you, Chris. So the next question is, what security measures are in place for the assessment data that is collected?
So that's a good question. You know, I think everyone's concerned about HIPAA compliance and where is patient data stored and can it be protected. One of the important things we did when we designed Assessant is to abstract the patient's identity so that only the third-party calling application can identify which patient has responded to a particular assessment. You noticed in Travis's demo that there was this long code. That code cannot be reverse engineered to determine who the patient is, and is required to be stored by the calling application so that whether it's the EHR or the practice management system, who is already being HIPAA compliant, knows how to retrieve that data, associate it with the patient, and prevent anything that we've captured in asking the assessment from being really considered to be patient-specific data.
Okay, thank you. We'll give everyone a couple more minutes to get questions in. And it looks like the next question is, can the software be installed locally as opposed to cloud-based access?
It absolutely can. This is Travis. Cloud-based or on-premise, based on requirements for your organization. So with healthcare, a lot of systems for security purposes need to be installed locally, and we have the software coded and architecture set up so that it can be done that way based on your requirement, either or. Absolutely.
Thank you, Travis. The next question is, what type of training is provided for Assessant?
That's very good. So we provide a guide on how to build an assessment along with several sample assessments, and that will help a user or a licensee know exactly how to build theirs. We also provide some added services. If someone wants us to help and go in and create a complex assessment and really show them how to do that, there's a lot of additional capability that the assessment tool has that we were not able to show today, such as driving outcome-based alerts and callbacks into another system, maybe sending out email messages driven by particular responses. Those are all capabilities, and we have added services that are available. Some are provided with the service, and others you would hire us as a consultancy to help you to create those. So you have really both options.
Great, thank you, Chris. As there are no more questions, this does conclude today's webinar. A recording of this will be sent to all participants. You will each be receiving our survey as well. Please do take a few moments and provide your feedback on today's webinar. In the meantime, if you have any questions, please contact us at info@microexcel.com. Thank you and have a wonderful day.